So our next speaker is someone I know for a long time. So in terms of talking about investment, I think he's probably the world's best at raising investment than anyone I know. So he's Laurence, founder, CEO of Vsee. Again, so he's going to share with you some insight on what he's doing. I'm also hoping he'll just maybe take a minute or so, share some of his insight. Again, he's just like amazing at raising investment.
Thanks. Well, thanks for listening to my talk. And so today we're talking about how telehealth can address the prediabetes epidemic. Some of you may not have heard of the phrase prediabetes before, but what it means is that you have elevated blood glucose levels, but it's not quite yet type 2 diabetes, but you're at a high risk for that. So we're going to start out by actually playing a short video that's actually a PSA announcement. And as we go through the video, I want you to count and add up your own personal score for this risk test. So you don't have to raise your hands, but you can talk to me after. But basically 1 out of 3 people in the United States have prediabetes, and it's directly related to the same epidemic of overweight and obesity. And actually 75% of people with prediabetes will develop type 2 diabetes. You might have heard projections like in 2050, people have said there'll be 30 million or 50 million people with diabetes in the United States, and this is true. And so one of the big public health interventions that has been developed to address this is the CDC's Diabetes Prevention Program, which is basically a 1-year-long lifestyle modification program designed to help pre-diabetic individuals lose 5 to 7% of their weight through diet and lifestyle changes. And it's actually 16 group classes delivered in the first 6 months that are 1 hour long, and 6 classes in the last 6 months. And it covers topics like diet, exercise, physical activity, sleep, stress management, grocery shopping, cooking. It's a standardized CDC curriculum that's used in this program. And it goes back to research that started at Massachusetts General Hospital, but then the YMCA got a big CMS innovation grant to do a study where they compared a placebo group to metformin to the lifestyle group, which was the diabetes prevention program. And they found that the lifestyle group had a better chance at reducing their risk for diabetes than patients who took metformin, and there was a 58% risk reduction for patients that lost the weight and completed the program. And seniors had above a 70% risk reduction. And this research was published in the New England Journal of Medicine in 2002, which gets back to that, I guess, 17-year rule of it takes so long to adopt anything in healthcare. And then after this, this study also had, I believe, about 3,000 participants. And CMS did an actuarial analysis showing that even participants that didn't necessarily even lose any weight, but they attended 4 classes, there was about a $2,600 cost savings. And it's also known that non-diabetic patients are just less costly to insurers and CMS than diabetic members. And so there's been significant cost savings proven, which is why commercial health plans have started to pay for this intervention. And Medicare will start paying for this in April of 2018. And they'll allow up to 4 classes through telehealth. But the commercial health plans are paying for this entirely through telehealth and group video conferencing, which is how Vsee delivers the intervention. And the other reason why the health plans pay for this program is that the Affordable Care Act requires health plans to pay for any preventive service that the U.S. Preventive Services Task Force gave an A or B rating to, and in 2014, intense lifestyle interventions received a B rating, and so health plans are required to pay for that within 1 year. And so the intervention they're required to pay for is not necessarily the diabetes prevention program, but many of the health plans have chosen to use the diabetes prevention program to meet the U.S. Preventive Services Task Force requirement. And so the way that we actually deliver the intervention is through group video conferencing. So, one dietitian and 10 patients on a group video call. The patients are issued a Fitbit, a wireless scale. They can take pictures of their food in a mobile app. But traditionally, the program was delivered in person at YMCAs and churches by trained lifestyle coaches, not even necessarily a dietitian. And the CDC has been administering this program. So I'm going to show you an example of a patient that went through the in-person program, and then we'll talk more about how we're taking that in-person program and creating a very similar experience using telehealth. Oops. You have the audio? Oh, there we go.
I'm a retired police officer. For the last 4.5 years, I've just been traveling and hanging loose. Well, when I was working at NYPD, it was very busy. You don't take care of yourself like you should. You would just eat whatever you could eat, whatever fast food, junk food in the vending machines. The only thing I knew about diabetes is that both my parents had it. My mother got it in her late 50s and my father got it in his early 60s. I never thought about it. I just thought, I'm young. I thought I was healthy. I was going to the doctor maybe once a year, and in the blood work, they test you for everything. It was a wake-up call. Literally. I was asleep one day, the phone woke me up, and he made me aware that I had pre-diabetes. I immediately thought about my parents, watching my parents take needles every day, and I just said to myself, I couldn't do it.
So Michael, you have peanut butter. What is the serving size for the peanut butter?
The counselors in the program showed me that this was in reach for me to prevent. And they showed me the right things to eat. They showed me the right things to incorporate in my life.
Michael absorbed the whole program. And once you do that, you can see the results.
Well, we meet once a week, and we talk about what we do in our lives and what changes we've made. It gives you a sense of, camaraderie. You learn something new every time you go there. Basically, I just started shopping better. I cook my own food, baked chicken, grilled chicken, boiled potatoes, steamed broccoli. I make smoothies, a lot of fruits, vegetables, not too much red meat, chicken and turkey. You can use what's around you. I do calisthenics right here in my living room. Or I'll just go outside and run around the park. Well, the motivation for me is, to watch my children grow and be here for them. And that starts with taking care of myself, my body. It may sound kind of dramatic, but it's like I'm running for my life. The results of my blood work for my A1C test are now close to normal. You really can reverse pre-diabetes. I'm proud to see how far I've come. I feel better, I feel stronger. I have a whole new life ahead of me. I plan to do a lot more traveling, try to hit every continent, and just live life to the fullest.
So that's an example of a patient that went through the in-person program. The Ad Council makes a lot of these public service announcements. But now I'm just going to explain more about how we're taking that into a telehealth model. And so traditionally a group of patients, let's say 10 patients, for example, would come to a YMCA every week. They would sit around a table. There's specific handouts that the CDC actually provides where they can track their diet and, indicate if they hit 150 minutes of exercise in a week. And so it's literally a group of patients just sitting around a table, and there's a lifestyle coach facilitating the class. And so when you think about how do you do that through telehealth, it's through group video conferencing. And so again, one dietitian and 10 patients on a group video call. The patients are also provided a free cellular scale, a body trace scale, and a Fitbit as well. Part of the in-person program is hitting 150 minutes of physical activity in a week. So that can be tracked with a Fitbit, or the patients can do that by manually entering that into the mobile app. And somebody recently mentioned to me that the group video conferencing reminded them of this Brady Bunch slide, which I thought was kind of funny, but this is kind of exactly how we're envisioning a group telehealth call to look. And so we actually created a concept video a couple of years ago when we started the company. We were originally just licensing the software to healthcare providers like dietitians and physicians, but now we're taking that software and we're delivering the diabetes prevention program. And so this video is a little bit non-specific to the diabetes prevention program, but I wanted to show you the Fruit Street concept video so that you could understand the functionality of the software, and then we'll talk a little bit more about how the insurance companies are involved as well.
Living an unhealthy lifestyle is a global problem. It increases the risk for conditions such as heart disease, diabetes, depression, stroke, and cancer. Because of this, we designed Fruit Street to help people lead healthier lifestyles by making it easier for them to be more active, improve sleep quality, eat healthier, reach their ideal weight, and improve overall well-being. We do this by combining video conferencing with wearable devices and apps. A young professional who wants to slim down, a father looking to reduce his blood pressure, a mother looking to sleep better at night, and even someone who only works out a few times a week. Fruit Street will help all of them live a healthier lifestyle. Fruit Street integrates with wearable health devices such as Fitbit, Apple Watch, Jawbone Up, Withings, and the iHealth Labs blood pressure cuff and glucometer. Devices like these track steps taken, hours slept, calories burned, heart rate, blood pressure, and blood glucose. These devices sync wirelessly with the Fruit Street Personal Health Record and sends data to your trusted healthcare provider in real time for analysis and feedback.
I have to travel a lot for my job and signed up for Fruit Street to learn how to live a healthier lifestyle. It's hard to travel often and stay healthy, but with the Fruit Street mobile app, I was able to conveniently improve my health with the help of my healthcare provider.
As the CEO of my own company, I never seemed to have the time to exercise and eat healthy. And my father passed away of a heart attack when I was just 19 years old, which worries me because heart disease runs in my family. Now my doctor told me that I have high blood pressure and I need to change my lifestyle. With Fruit Street, staying healthy just became simple.
Living a healthy lifestyle can be difficult, but this is the reason we exist. Through technology, we help lead you to a healthy lifestyle in the easiest way possible. With the Fruit Street mobile app, you can log your food and receive feedback, video chat with your healthcare provider, view your goals, and track your wearable device data. You now have a trained healthcare provider in your pocket, looking out for your health every single day. So what are you waiting for? Sign up today and begin living that healthy lifestyle you've always dreamed of. We're here to help.
So that's just a concept video so you can understand the software, and I just go through a few screenshots. This is the mobile app, so you can actually just take a picture of your food, very Instagram style, and uploads in chronological order with a timestamp. So let's say a patient drinks a soda, the dietitian can actually monitor that on a web portal and see exactly what you ate the last 7 days and write a comment like, try water instead, and would actually send a push notification back to the patient's phone, and you can comment back and forth just like if it was an Instagram picture, for example. So we've had patients take about 100,000 pictures of their food, and this is actually the most popular feature in the application. And then patients can also view their health records. So each patient has a personal health record that integrates with devices like Fitbit, wireless scales, FDA-approved blood pressure cuffs, glucometers, and those types of devices. And the patient can see their own data, but also the healthcare provider can view a list of here's my 200 patients. And then as the patients are doing those things, the data is uploading in real time, and the dietitian can monitor that data. And one of the requirements of the CDC program is that you would weigh the participant in person. So the participants have to have a wireless scale to do this program. You need a way to monitor physical activity and diet because that's what you would do in an in-person program. And this is just a screenshot of the dietitian's view of all of their participants and kind of that data uploading in real time. And then this is just the mobile app, so you can do the HIPAA-compliant video conferencing, text messaging from the mobile app as well. And Vsee powers all of the video technology within Fruit Street and actually builds the entire platform for us. But now let's talk about how the health plans get involved. And so we have a partner called Solera Health, who's one of their big investors, Blue Cross, and basically they structure contracts between preventive service. They're a preventive services benefits manager. So they structure contracts between health plans and providers of the diabetes prevention program. And so they'll go to a health plan and they will do consumer-style marketing to the health plan members to encourage them to sign up for the diabetes prevention program, at which point they're either matched to an in-person program if the patient might not be as tech-savvy or they just prefer to come in person. For a lot of older patients, that could just be the social interaction of being in person, or they go to a virtual program like Fruit Street, for example. And then at that point, Solera actually pays us $345.60 per patient that goes through the program. And the first milestone of that is that the patient comes to us and they download the Fruit Street mobile app. So we get paid about $66 for that. The second time there's a medical claim submitted is when the patient attends the first 2 out of 4 telemedicine classes, but they were also meaningfully engaged for 2 out of 4 weeks. So what that means is that they did 2 out of the 4 following things. They took 5 pictures of their food in the mobile app. They weighed themselves 3 times in the scale that was provided to them at the beginning of the program. They reported physical activity, which can be done with a Fitbit or by typing it in manually to the mobile app. And then the 4th milestone is text messaging once in that week with the coach. And so that's the second milestone. The 3rd milestone is the same as the second milestone. And then the final milestone is 5% weight loss. And so for a 200-pound patient, that could be 10 pounds in 1 year between week 9 and week 52. And so this data is sent back to the health plan with the help of Solera Health. And we also send the data to the CDC, who has a recognition program and is making sure that we hit the outcomes that are required as well. And so that's basically how the health plans get involved. And Solera will be speaking on Friday, and they have this model where they have community programs throughout the country and then virtual programs that are in different formats. For example, they even have a partner that delivers the diabetes prevention program through Amazon Alexa to blind patients actually as well. But Fruit Street's interesting because we're so similar to the original clinical trial where, again, a group of patients came to a YMCA. If you're doing a virtual group video call, it's almost identical to if you were sitting around a table, but you don't have that barrier of driving. And then when you bring in the Fitbit and the scale and the pictures of the food, you're getting a very accurate view of what the patient is doing in terms of their lifestyle, but the patient doesn't have to write down what they're eating on a piece of paper, which is actually what a lot of community programs around the country are doing right now. And so in case you didn't like puppies, you can have one more version of the risk test video. So if you had a high score, it doesn't necessarily mean that you have prediabetes. It's you can diagnose that through a blood test. And if you're over 60, don't worry because it's almost impossible not to score above a 5. You're over 60, so the questionnaire does kind of fail in that regard. This is just a nice quote that I like to share. So the function of protecting and developing health must rank even above that of restoring it when it's impaired. And so I think that through programs like the Diabetes Prevention Program, we really have to focus more on prevention if we want to control healthcare costs and really just do the best thing for patients. And so we're really excited to deliver that program. But if you did score above a 5, we're actually allowing you to register for free with our in-house dietitian, Rachel, who's in the back. And 1 year from today, after you go through the whole program, we'll see what the outcomes were, and we'll publish that maybe as well. And so just email Rachel at fruitstreet.com if you want to sign up for the program. I use it for myself and lost about 15 pounds, so it definitely works. And I'll take questions. or did you want me to also talk about the fundraising and all, or no? Okay, yeah, I mean, so Milton wanted me to talk a little bit about our fundraising model. Grassroots movement of physicians that want to improve healthcare with technology and really build something that could benefit their patients. And so through that model, we have engaged these physicians through really just LinkedIn and the magic of LinkedIn, and also kind of engage them in a medical think tank model. And I guess the takeaway from that is that I think we don't always have to wait for like an institution to support something. We can kind of do grassroots movement, especially among physicians, to kind of just take what the science says and just do whatever's the best thing for patients. And so and the other point is that we formed Fruit Street as a public benefit corporation. So we are for profit, but we write our social mission into our bylaws, which is to prevent and treat lifestyle-related disease using telemedicine, wearable devices, and mobile applications. So I think a lot of our investors who are even here today, they're not just investing because it's a good investment. They're investing because they want to have a social impact. And I think in healthcare, it's a really interesting model to think about. Maybe you don't need to go to Silicon Valley venture capital firm, even though we're here right now. But you could go to physicians or other types of investors that are also investing because they want to have a social impact as well. Is that good? So.
Thank you for speaking. I think that model, I'd never heard of that until earlier today, but I think it's super cool for fundraising. And I'm a big believer in DPP in general, so that's all awesome. I'm curious, we're at this telehealth conference, and you've emphasized one of the things that you've done with Fruit Street is to really take DPP and use the technology to replicate it seemingly as close as possible what was done in the YMCA study and that kind of non-telehealth model. And I'm curious how you came to that, right? When you were building this out, was the goal really, we want to stick with what was done as closely as possible because that's where the evidence is? Or did you consider, what are sort of the other ways that this might look if it was done in a pure telehealth way? And how did you end up at the model that you're at right now?
Yeah. So the whole company started because I was originally planning to go to medical school, and I was working in the emergency room while taking a nutrition epidemiology course, which is very rare because it's total opposites. And originally, we actually were licensing the software. So we have dietitians that license our software, for example, and physicians, some who are here today, and they use the software to do HIPAA-compliant video calls, monitor diet, monitor the wearable data, and they either charge their patients out of pocket or they in some cases get paid by insurance. And we started out with that model because it was actually very difficult to get the insurance companies to even talk to us. And that's why we're so excited about Solera Health, is that they've contracted with 18 health plans that cover 40 million lives, and they take all the contracting with the health plan out of our hands, and so it's much easier. But then the other reason, aside from Solera, that we eventually decided to go down this route is that there's so much public policy momentum for this and reimbursement that the payers can really get on board with this because they say, look, there's this major study in the New England Journal of Medicine. CMS did an actuarial analysis. They're going to pay for it in April. And so, it's easy to just say, diet and exercise, but, what's the evidence? And I think most people would say that DPP is one of the most evidence-based programs for lifestyle. And that's why we chose to use that program. However, from a scientific perspective, there's other use cases that Fruit Street's being used for, like chronic kidney disease, blood pressure monitoring, adolescent weight management at the University of Michigan, for example. It's just kind of like, as a startup, where do you just focus in the beginning and where's the reimbursement? And so we followed this program because of the reimbursement pathway partially and the science is there.
Do you have a group of nutritionists nationwide that we can connect with as internists in primary care?
Yeah, so let's say you're a primary care physician and you want to refer your patient to this program. Basically, we'll have a direct URL where you could send the patient, and then Solera will run an eligibility check with the health plan, and they will basically make sure that the patient doesn't have any cost to them, and then Fruit Street will deliver the program. And we'll report back to you what happened. You don't even need the software in your practice. You're just literally referring the patient in by sending them to a web URL. We also have a physician referral form that you can fax in as well. And so we're working with one of the larger employers of dietitians. So we have almost an unlimited army of dietitians that can work with patients. And CMS thinks a lot of the referrals will come from physicians. And as you said earlier, a lot of physicians don't have time to do diet and exercise, but you can screen your patients. You can look at the blood glucose results and say, okay, you're pre-diabetic. This is why it's important. I'm going to refer you into a program. And so we're definitely looking for physicians to refer their patients. Right. Yeah, you just send the patient to us and we do everything. Yeah. And then we say your patient lost 5% of their weight. Their risk for diabetes is cut by 58%, and that's it. So, yeah.
Curious. I'm a primary care physician, and we have an integrative practice where I have a healthy lifestyle coach that consistently works with our patients. But we find that, yes, you have weight loss, but when you look at long-term outcomes, of course, oftentimes life gets in the way and people gain that weight, right? So for me, the significance would be that long-term result. So is there some option for people to still maintain counseling or contact with the dietitian?
Yeah. So the commercial health plans only pay for 1 year of the program, but the patient's free to continue paying out of pocket, and Fruit Street will continue working with them as long as the patient wants. The other option in your case is that you could actually become one of the providers of the diabetes prevention program, and Solera would potentially, depending on where you're located, send you patients. You could also license the Fruit Street software where your health coach is doing the dietitian type of counseling, but then maybe you're using Fruit Street, which is powered by Vsee, to do medical telemedicine consults. And then CMS is planning to make it a 3-year program where I think the proposed amount is about like $800, where they really want to see what happens in 3 years. But right now the commercial health plans just pay for 1 year of the program. So those are some ideas for you. Any other questions?
Wonderful presentation. Thank you very much. United States Preventive Services Task Force now recommends this. So this is a Category B recommendation. So I think at this point now, there's a lot of substance there for following this avenue. Certainly going to think about doing it. Thank you.
Yeah, definitely. Any other question? Okay, good. Thank you.
Thank you so much, Laurence. So even though Laurence raised quite a bit of money, so if you're interested in getting on the Fruit Street bandwagon, you could come to the dinner tomorrow and maybe bring your checkbook. I know he'll sign the paperwork there now. So our next speaker, we're going to spin up a little bit, take the dimension, and have Nathan talk about the legal aspect. So you probably know we actually do quite a bit of these talks. We do video webinars and stuff. In fact, Nathan is one of our most popular speakers at all the different events we do. So typically